Hello everyone, I'm Charishma. Our current healthcare system is becoming increasingly outpatient-based across multiple specialties. However, simulation-based outpatient medicine experience is underrepresented in medical education. Despite the limited exposure of medical students to ambulatory care, there are few training courses to amplify the students' preparedness in this area. So we designed Day in the Clinic to be a part of our specialty neutral MS4 Bootcamp. Our goal was to prepare our medical students for their upcoming clinic rotations during residency in a safe environment prior to their actual patient exposure following graduation. Now, the primary objective of Day in the Clinic was to increase the students' skills and confidence in ambulatory medicine through simulation-based activity. Each case was strategically designed to enable students to clinically integrate and apply evidence-based knowledge, thereby focusing on EPAs 4, 5, 6, 10, and 13. We also incorporated elements to enhance effective interpersonal communication with nurses and other support staff. Now, coming to the methods, all the Day in the Clinic activities took place in the Simulation Center at Texas Tech El Paso. Following a brief orientation, each student rotated through 4 clinical encounters. Similar to an intern clinic workload, each student saw 4 patients in 4 hours. The 4 cases were designed to highlight vital aspects of ambulatory medicine and transition of care. For example, in one scenario, a patient presents to the clinic with acute chest pain. The student will have to recognize the emergent nature of the presentation based on the information provided and act accordingly. The student should order aspirin, activate emergency response system to send the patient to the hospital, and also articulate that there is a concern for unstable angina. In another case, the encounter includes an uncontrolled diabetic patient. Here, the student will have to educate the patient, make all the necessary medication reconciliation changes in the EMR, and make appropriate referrals, so on and so forth. Similar to the resident clinic, all students will have to document the clinical encounter in the simulated EMR. Students will have to coordinate the care with the standardized nurses, and the standardized nurses also will interrupt the students with short clinical scenarios similar to actual resident clinic. The faculty, standardized nurses, and simulated patients provide immediate and thorough feedback for the students. The simulated patients and the standardized nurses fill out post-simulation checklists. The faculty debriefing is done in small groups of 4 or 5 students. And during the debriefing, each student will have to do oral case presentations, which are also evaluated by the faculty. And the faculty encourage peer-to-peer evaluations in order to facilitate a robust discussion. Besides this, the documentation in the EMR is also graded by the faculty. The competency-based evaluation forms designated for each clinic case are used for feedback. We look at the student's confidence level in performing the activities through pre and post surveys. Now, coming to the outcomes, we noticed a statistically significant improvement in the students' confidence in the areas related to Day in the Clinic activities. And the students consistently report that Day in the Clinic was one of the most beneficial activities in the bootcamp. Overall, this is a very resource-intensive activity, and it involves extensive planning and meticulous execution by the staff. And hiring standardized patients and standardized nurses could be expensive. It is also faculty heavy due to all the hours that faculty spend to supervise and evaluate the students. But all the effort was worth it because the students were clearly benefited from it and they rated it high. We would be more than glad to collaborate with anyone interested in implementing this activity at their institution, and it should make it a lot easier to execute. Thank you.